Welcome back, my good people. We are still dealing with a very big and longest topic about fibroids, and I think we are just finalizing this topic. And for those who had requested this kind of a topic, because I've done it for almost 1.5 weeks, and I hope you guys you have got what you needed. So let's continue subscribing, sharing, and keeping the support on so that this channel may reach as many people as possible. So let's get back to our final part of our topic, whereby we'll be discussing about the relation between fibroids and fertility, and more so, does fibroids interfere or affect a lady's fertility, or is a lady having fibroids unable to conceive, or can a lady who has fibroids, can she conceive and give birth? So many people are concerned about whether fibroids affect fertility, but it's estimated that 1 or 2% of infertility cases are blamed on fibroids. Get this point? They are just blamed on fibroids. So this means there is no surety whether it's the fibroid causing the infertility. So they are just blamed on fibroids. Note this, and this is very important. In particular, submucosal fibroids can affect fertility, since they can change space within the womb and could prevent fertilized egg from implanting. I want you to get this point very clearly. In particular, submucosal fibroids can affect fertility, since they can change space within the womb and could prevent fertilized egg from implanting. This doesn't mean that the lady is unable to produce an ovum. The lady will produce the ovum. Fertilization will take place in the fallopian tube, and after fertilization, obviously the implantation takes place in the womb or in the uterus. So when the fertilized egg comes from the fallopian tubes to implant in the uterus, the only way fibroid causes infertility is whereby it occupies the better part of the womb to prevent the fertilized egg from implanting, or the fertilized egg won't get a space to implant. That is the only way it can cause infertility, but it doesn't mean that the woman is not producing an ovum. I hope you got that. So let's talk about fibroids and cancer. Fibroids and cancer. Fibroids are not linked to cancer, but healthcare providers used to think they might increase the risk of cancer. Get this clearly. Fibroids are not linked to cancer, but healthcare providers used to think that fibroids, get this, fibroids might increase the risk of cancer, but there is no evidence for this, and scientists agree that they are not a risk factor to cancer. So fibroids are not a risk factor to cancer, or they cannot cause cancer. So when ladies have fibroids, they might be so worried and think that they might be having cancer. So remove this from your mind. Fibroids is not a risk cancer to one getting fibroids are not a risk factor to one getting cancer. So let's talk about the treatments. So treatment for fibroids varies and it's best to speak to your healthcare provider on the treatment options best for you. So I can't just tell you the best treatment for you simply because you might be having fibroid, but where I'm seated, I don't know whether you are having an intramural fibroid, subserosal fibroid, or pedunculated fibroid. So when you have a fibroid, just visit your healthcare provider who will give you the available treatment options best for you. Some treatments control symptoms of fibroids. They don't treat. So they control symptoms of fibroids. For example, heavy periods. Other like surgery address fibroids themselves. So some treatments don't treat this or don't shrink the fibroids, and we talked about this. So they don't treat or shrink the fibroids, they just relieve the symptoms like heavy bleeding or pain, whereby you give brufen. But surgery addresses fibroids themselves, reducing the size or removing them all. So what are the two common treatment methods used on this pedunculated type of fibroid? One, and we talked about this, we have what we call uterine artery embolization, or UAE. This is a process that cuts off blood supply to the fibroids, making fibroid shrink. Simple. Very simple. Uterine artery embolization is a process that cuts off blood flow to the fibroids, making the fibroid shrink. If there is no blood supply, there is no oxygen, there is no nourishment. So definitely the fibroid will shrink. Note this, most effective, this uterine artery embolization is most effective for subserosal fibroid, for example, because they are outside the womb. Another point to note, fibroids can recur or they can come back even after the surgery, and the procedure can be repeated. If they recur, the procedure can also be repeated. Which procedure? Uterine artery embolization. Number two, the next commonly treatment method used is what we call myomectomy, and we discussed about this for those who have been following my videos. This is whereby there is the removal of the fibroid and repair the uterus. You remove the fibroid, repair the uterus. So in some cases, myomectomy can lead to hysterectomy. I talked about hysterectomy. I explained what hysterectomy means, whereby there is the removal of the uterus involving the fallopian tubes. You will discuss all these things. So in some cases, myomectomy can lead to hysterectomy or removal of the uterus. You can remove the entire uterus. So in other cases, people who have had myomectomy will need to deliver in cesarean section. So if you have had myomectomy, you will need to deliver by a cesarean section in future. So this marks the end of one of our most hectic and large topic we have ever discussed, and I think those who have requested this topic have discussed it in deep and you have been educated. So let's continue sharing the videos. Let's not just read and leave them on the internet. Let these topics help your brothers and sisters because fibroids are always common in our day-to-day life. So this marks the end of the whole topic about fibroids. And if you have another question, maybe you have not tackled it, you can always put that question in our comment section, and I will be in a position to tackle it. Guys, have a nice evening, and let's meet in the next topic tomorrow, which I will be able to decide which topic to discuss among the very many you guys have requested. So have a good time, and may God bless you.